Okay, thanks. Oh, well, hello everybody, and thanks for asking me to come today. There's so much that I could talk about thinking about COVID and the last 15 months, 17 months, however long it's been, and kind of the impact. But I do want to leave time for questions. So I thought I'd talk a little bit about. Well, I saw the topic of the afternoon is thinking about anxiety coming out of lockdown. So I thought I'd talk a little bit about anxiety. As a GP, I think we've seen the consultations for anxiety kind of really rocket over the past year or so, not surprisingly, but I started thinking about that in my mind and kind of how, if I was going to kind of categorize it and try and get some kind of logic into it, what type of things are kind of making people anxious. So there is, of course, the kind of the general anxiety just regarding the pandemic, the fact that we have this global virus that's causing lots of us such misery and such ill health and death, which obviously I think the general population is suffering with anyway. Then there is kind of anxiety generated by kind of the loss that we're all experiencing. So some of us have experienced the ultimate in loss, bereaved ones, losing loved ones, losing jobs, but also losing that social contact and those experiences that that we would take for granted. I don't think we'll ever take them for granted again. But so one of my sons turned 18 this year, and he celebrated with his friends in the park, which is very sweet and actually probably much healthier than the way we all celebrated our 18th birthdays. But it's one of those things, isn't it? I think that the change that we've all experienced brings about kind of huge anxiety. So we've had to work from home, or not work from home, go back into the office, or not go back into the office. And the way we've got around, public transport or kind of walking, all of those things have changed. Wearing masks, kind of to go to the supermarket, queuing up outside the supermarket to go in for food, all of those things cause can feed into our anxiety. Schools closing. And then there's the uncertainty about the future. And I think that we're all still living with that now. Things are starting to open up, and that's great, but we're not really kind of back to normal. And I'm not really clear, I don't think anybody is, about what normal will look like in the future. I think that also kind of another thing that can trigger kind of anxiety is just boredom, kind of not having enough to do, not kind of not being able to access the resources that we usually use to keep ourselves well and healthy. So for instance, if part of your self-care regime would be going to the gym, kind of people haven't been able to do that for significant amounts of time over the past year. And then there's probably been another group of people that I've seen that have maybe always had underlying anxiety, but they've managed to look after themselves. So they've recognised, they're very self-aware, they've recognised their symptoms, and they've managed to, kind of through various strategies and various self-help techniques, have managed to keep a lid on their anxiety. But this has just been one, kind of the last straw really, and it's unmasked a great deal of previously, undiagnosed, I suppose, anxiety. But there have been some positives, I think, about lockdown. I think that certainly 12 months ago, during the first lockdown in particular, I think it gave us time to reflect. I think it gave us time to reconnect with close families. I think it gave us, there was certainly everything was a lot quieter. I could have, from a personal point of view, what I noticed was I could hear the birds sing, and I'd not particularly noticed that to that degree anymore. But that's something that I've managed to still be aware of, and I'm still, whenever I go outside, I'm acutely aware of listening to the birds singing, and you've all just done mindfulness, so you'll be well tuned into what I mean by that. I'm very jealous I missed that session, by the way, but hey ho, we can't have everything. So I think that there has been kind of positives about that. I think that the sense of community spirit that we've engendered, and kind of people looking out for each other, has been a positive thing. And I think that awareness of kind of mental health, certainly amongst the media, never seems to have been higher. And maybe that will translate in the future into kind of into better and more responsive services. But one of the briefs that I had was kind of, you know, how we can keep ourselves well. I think you probably had a lot to do with that today. But, you know, kind of, I think that as a GP, I can't stress enough the importance of lifestyle, the importance of doing all the things that we know we should be doing, you know, kind of all the time, but kind of particularly when we're feeling anxious or stressed. It's important to eat really well, to try to get enough sleep and relaxation, to exercise regularly. As I say, when the weather's nice, preferably outdoors. Being outdoors and in nature is really, really key. Try to avoid the kind of negative lifestyle behaviours, such as, you know, kind of drinking too much alcohol, smoking, you know, kind of too much caffeine. All of these kind of play you know, a negative role on our mental health. And then I feel sure that Matt probably mentioned these this morning, but there are kind of what we call the 5 ways to well-being, which is, you know, I've already mentioned a couple of them: exercise, you know, connect with the community, connect with your colleagues, connect with your family, try to learn something every day, try to be mindful, and what's the one that I'm forgetting? That's the one I always forget. You know, try to give something back to your community. All of these things have been scientifically proven to improve our well-being. But I think that, you know, the other thing that I would stress is that if all of these things are not working for you, then, you know, kind of the NHS is here for you. Your GP practices are very much open and want you to contact them if you are struggling with any of these things. In addition to that, you know, kind of, I would always recommend the Talk Liverpool website, which you just Google Talk Liverpool and it comes right up to the top, which has loads of great self-help resources, and it's the website that we use as GPs. And should you not wish to speak to your GP, you can signpost yourself to services through that website. So I think that's probably all I'm going to say about anxiety. I will mention a little bit about the vaccination program and then just very briefly touch about long COVID, if that would be useful. Is that a good use of your time? Okay, well, I'll just go ahead. Okay, all right.
Definitely.
So the vaccination program. So I may be repeating a lot of things, so I won't go on at length. But there are basically kind of several sites which are providing vaccinations, and the first sites to open were hospitals. And I think that was mainly because the vaccinations were new, as we all were aware, and so we all saw those people attending outpatient appointments before Christmas, didn't we? And they get their vaccinations they got their vaccinations there. And the hospitals since then have mainly been providing vaccinations to health and social care staff. The next site providing it are the primary care network sites. So you may or may not be aware that all practices in Liverpool are grouped into what's called primary care networks. It's a group of, it can vary from between 4 or 5 to 15 or 16 practices who work together to bring services to their local population, and it's supposed to be a bit more reflective of need and what the kind of the community may specific needs of a specific community. So the primary care network sites have been delivering more than 75% of the vaccinations. The other service, I suppose, that's delivering vaccinations is pharmacies, and you will be aware of that. You may also be aware that in different parts of the country there are mass vaccination centres. You may be aware there's one in Manchester at the Etihad, I think, and one in St Helens. In Liverpool, we don't have a mass vaccination centre, and that was a decision that we took, you know, kind of all local leaders took, that that actually we would rather that resource went into more community-based centres. So what happened then was that there was more local services centres that were developed. So there was an extra centre in Princes Park, and there was an extra one in my primary care network, which is in North Liverpool. So we opened up a vaccination centre in Norris Green in the Lifestyles, the gym there. We've had to move that because obviously the gyms have opened up again, and so we've recently opened up a vaccination centre at Croxteth Park, which logistically has its challenges, but I think is proving quite popular. And then the latest development for delivering vaccinations is the bus. So there is a mobile vaccination unit that goes around the city over a weekend at the moment. And that's really trying to reach into those parts of the city where vaccine uptake maybe hasn't been so good. And then, okay, so that's all I'll say about vaccinations until I'll take questions on that, obviously. And just briefly a little bit about long COVID, because I think long COVID will be challenging for us as both as a healthcare provider, but also as a community, for over the next year or two. We don't know that much about it yet. What we're currently defining it is somebody who's had COVID, or you suspect to have had COVID, because in the early days, certainly we weren't testing, but we now know that kind of people are describing, kind of the typical symptoms, and then symptoms that have gone on. And it seems that the loss of smell and taste is more important in making those retrospective diagnoses than we knew. So long COVID is diagnosed of persistent symptoms after 12 weeks. And there's kind of there's multiple symptoms, and it may well be that this turns out to be more than one condition, but at the moment we're calling it long COVID. The physical symptoms mainly seem to be breathlessness, chest pain, palpitations. Some people are getting gastrointestinal symptoms, so abdominal pain, diarrhea, nausea, things like that. Anxiety is a big thing, directly related to COVID, and that is sometimes related to how severely ill somebody was, and sometimes related to just having the disease in itself. And the other thing that people are talking about a lot is brain fog, that feeling that you just can't think properly. Your memory is affected. We know that some people with very severe disease that caused kind of significant damage to their brain structure. So it doesn't seem to necessarily long COVID be related to the severity of the original illness. So some people who had relatively mild, symptoms that would just be consistent with flu or a bad virus have then gone on to develop long COVID. But I think that your risk of getting long COVID is higher if you were actually hospitalised. So in Liverpool, we have set up a long COVID service, which is just about getting going, and that is hosted by the Royal Hospital. So it's being run by the Royal Hospital, and referrals through your GP, and the kind of the respiratory there is a service called pulmonary rehab. So they're kind of a group of physiologists and physiotherapists who support people with chronic lung disease with a kind of a rehab program, and they are supporting people with long COVID for their recovery as well. And there are kind of apps and websites where people can, if they don't feel they need kind of that one-to-one support, can also access help. The specific one that I think of is called My COVID Recovery. And that's probably all I will say for now, just to give you time for questions. Although if you want me to expand any more on anything that I've already spoken about, or anything else you can think of, just let me know.